Remember Dolo, our favorite medicine for fever and pain during COVID times? Light, quick and effective. Well, Dolo was our go-to medicine. It was considered so safe that even pregnant women were prescribed. And then came the allegations that the makers were spending about 1,000 crore rupees on freebies to doctors to prescribe the drug. Even though the company denied it, medical representatives told the Supreme Court that the pharma company spent that much amount of money to get Dolo 650 prescribed to patients. Now, interestingly, a Dolo 650 tablet contains 650 milligrams of paracetamol. Paracetamol is the main ingredient. So when we already had that in the market, suddenly how did one particular company's tablet come up during COVID? How did it become more effective than others which are already in use? The National Medical Commission came out with a guideline for doctors. It made it mandatory for doctors to prescribe generic drugs, but barred them from endorsing any brand. It also barred them from accepting gifts from pharma companies. And if doctors fail to comply with these guidelines, that doctor will be penalized and their license will be suspended for 1 year. Now, the NMC supported generic drugs prescription due to one major impact that it would have had, and that is lowering healthcare costs in the country. Remember, India's out-of-pocket spending on medications accounts for a major portion of public spending on healthcare. Generic medicines are 30 to 80% cheaper than branded drugs, and therefore, more and more people would be able to afford them. But this rule has now been put on hold. How did this happen? Well, this came after the Indian Medical Association and the Indian Pharmaceutical Alliance met the Union Health Minister, Mansukh Mandavia, and expressed their concerns, saying prescribing only generic drugs is not feasible because of their uncertain quality. According to the Indian Medical Association, less than 1% of the generic drugs that are manufactured in India are tested for quality. India has more than 3 lakh batches of 70,000 drug formulations, and the quality assurance mechanism in our country, as per the IMA, can ascertain the quality control of only 15,753 drugs annually. They also suggested that registered medical practitioners should be allowed to attend conferences sponsored by pharmaceutical companies or the allied health sector. Now, why did the NMC suggest only generic drugs in the first place? Why are doctors opposed to lower healthcare costs, as would have been the result due to this move? Let me take this across to my guests tonight. 2 doctors are joining me on the show tonight. Let me put these questions across to them and understand their perspective. I'm joined by Dr. Rohit Bansal, Associate Director, Neurosurgeon at BLK Max Super Speciality Hospital in Delhi, and Dr. Rajeev Jayadevan, Co-Chairman, National IMA COVID Task Force, also joins us tonight. Welcome, gentlemen. Thank you very much for talking with Mirror Now. First to you, Dr. Jayadevan, IMA has, of course, expressed its concerns over this order by the NMC, and now it has been, of course, put on hold. But help us understand what are the reservations that doctors have in prescribing only generic drugs.
Thank you. That's a good question. Doctors across the country are unhappy at the new restrictions that were about to be put in place, preventing them from prescribing products that they have discovered through years of experience, through patient feedback, good feedback. Patients do not improve. Doctors switch medications when patients do not improve, and they interact with their peers. They discuss medical outcomes during medical audits within hospitals, in conferences, in CME programs. There are a lot of academic activities, particularly in our country, that keeps our doctors up to date with medical knowledge. And within that medical knowledge is the awareness about products that work. And among products that work, they prefer to write a prescription on something that they know will help the patient. Remember, the patient comes to the doctor for relief of their problem, and the doctor, by his or her oath, is sworn to alleviate the patient's suffering. Nothing else comes in the way. Now, in a country like ours, if we look at the various parameters that affect the quality of care, one is, let's say, as always, doctor's education, qualification, experiences. How often does the doctor keep himself or herself updated? Does the doctor attend conferences? Second is the quality of the healthcare setting the doctor is working in. Is the doctor able to spend enough time with the patient? Does the doctor have available facilities? And third, is the doctor able to prescribe a product that he or she believes will help the patient? Now, the new regulations are a big blow to the third arm of patient care. In the end, the patients will suffer. It is true that the intent is good in a sense that we want to reduce the overall cost. It's true that generic medications across the board, they cost less than their branded counterparts. But that comes at literally a price. As was heard earlier in the program, there is the quality control in our country for the medicines produced is not anywhere close to what there is in developed nations. So in other words, writing a generic prescription in the United States is not the same as writing a generic prescription in India. So doctors become unhappy when they find that their prescribing privileges are lost or restricted unreasonably. So this is the reason why doctors are unhappy.
Okay. Point considered. Fair enough. Dr. Rajeev Jayadevan, you've elaborated quite in detail what the reservations are, and we understand that doctors are considered gods in this country, and it is of course a noble profession. But with all due respect to that, Dr. Rohit Bansal, to you, then how do you explain allegations such as what happened during the COVID time with the Dolo 650 being popularized, and then allegations came in of thousands of crores being spent just to push that company and doctors prescribing it. These also have been allegations. Now, when it comes to generic drugs, we already have those in the market. Number one, like Dr. Jayadevan said, that quality check controls are a problem. But even with branded generic drugs being pushed by doctors, that itself could be a problem as well, because just because one doctor or a particular medical practitioner is being pushed by the company to push that drug forward doesn't necessarily mean that it's the best among the lot.
Absolutely. I think a very good issue that you have raised tonight, Shreya. And as Dr. Rajeev very rightly pointed out, that no physician, no doctor would have any problem in prescribing generic medications. In fact, generic names are the ones that we have been taught while we were trained in the medicine. However, it is the quality that government has to ensure. So speaking about the crisis of during the COVID time and the allegations about Dolo, being a frontline warrior of COVID during the tough times, trust me, I was not forced by any organization, any company, or even my organization to prescribe Dolo. So this comes with years of experience. So paracetamol is a very basic salt for controlling fever that everybody knows. But after 20 years of experience, you know which medicine, which brand actually has paracetamol, that right amount of paracetamol, which is going to bring down your fever. So when a patient comes to me to control his fever or seek medical help for his fever, he trusts me with the medication that I'm going to prescribe him. So the generic name that I'm going to write on my prescription, I do not know whether he's getting that adequate salt or not. So how do we ensure that quality? How do we ensure that, that standard? So that is where the concern is. That is where the problem is.
Okay, help me also understand, Dr. Jayadevan, we are talking about quality check in this country. For a lot of people who, like me, are not very well versed with medical jargons and the nuances of medical technology, help us understand, how do generic drugs really go through quality check control in this country?
The percentage of drugs that go through quality control, as we heard earlier in the program, is in fact quite small. Nobody has an exact figure. I did search for it, but the number is apparently very low. As to how quality checks are done, that is not my area of expertise, I'm afraid. But I can tell you from knowledge of pharmacology, quality checks can be done broadly at two levels. One, at the level of the manufacturer. That is the manufacturer manufacturing this product in an air quality controlled factory with dust control, using raw materials which are legitimate, using first quality salts that are typically they are imported from other countries. There are several ingredients that go into the manufacturing of a product, and there are several grades for these ingredients. And when they are put together, they may be put together as a tablet or a capsule, and there's a filler that goes along with it. Is the filler harmful to the patient? We all heard about the NDMA fiasco. I don't need to elaborate on that, the cancer-causing impurity that was found in some medications. And that was discovered by the US FDA. And they alerted the rest of the world that some products are containing these cancer-associated impurities. So it's not just a problem of the amount of medication that is the promised amount in there. In other words, if 1 kg of rice is promised, does the package actually weigh 1 kg? That's one. Second is, does the rice have any impurities in it? Is there contamination? Is there adulteration? So all of these are concerns, and we have seen media reports of shady firms that are perhaps quasi-legal, making what is supposed to be modern medicine products in dingy warehouses, in no address locations. And we know of reputed manufacturers who keep a very strict quality control. And there's a difference in the products produced by these. Not only is the production important, but the storage is important as well. For instance, a salt or a medication that's kept in a cold storage facility will last longer. Its active ingredient will last longer. It will not expire. Whereas in these shady godowns where large boxes of medications are kept in hot, humid conditions, the active ingredient might expire even before the date of expiry on the medication. So this is a very, very complex question. The second level of checking occurs in government designated laboratories. As I understand, in the state of Kerala that I work, there are 2 government facilities that actually test these products. And I have here in front of me a report from Madhubhumi, right from last year, that seized low quality generic antibiotics and multiple other products from a government firm that was manufacturing these products as generics. So this is not a myth. In other words, generics are having a quality problem in our country. And until we have an assurance, we, in the sense the medical community has an assurance that all generic medications, whether they are generic or branded generic, have a universal seal of quality like it exists in developed nations. Once that happens, doctors will have no trouble switching to generics. As Dr. Bansal said, we are trained in generic names to start with. But eventually, through practice patterns, we realize what works for each patient, and doctors tend to stick to their time-tested prescribing patterns.
And so, Dr. Rohit Bansal, how do we bring about this change? How do we bring about this, standard quality that is followed around the world? How do we get that in India? Where are we lacking? And what do we need to do more of or less of to have a proper quality check and a good quality generic drug in, for just like for any regular illness that we might have?
Again, that's a very good question. The quality assurance for a drug is the responsibility of the government and the national bodies per se. So right now, there are thousands and thousands of companies who are manufacturing drugs in India, particularly generic drugs. So the generic drug quality assurance, there is no, like you said in the beginning, there's only 1% quality check. So we do not know the market, the drugs which are coming into the market are genuinely true or not. Are they actually true or they're fake? Even so, recently we had this sad news of 65 children in Gambia dying because of cough syrup that was manufactured in India. So this is something very criminal. This is something which is unacceptable by any standards, any stretch of imagination. So I think the government should lay down very strict norms, strict guidelines to produce and bring down the drugs in the specific set of drugs in the market. There should be repeated quality checks. Like Dr. Rajeev said, the expiry date and the quality should be assured before they are actually brought on the shelf.
Okay, also, another thing that comes to mind amid this discussion that we're having is also the fact that the doctors might not do it. The doctors might not push for branded generic drugs. But then, for example, when I'm sick, I would go to the chemist, to the local pharmacist, and I would ask for a certain medicine, and he or she would say that, this is not available, but the other one is available with the same composition. So aren't we sort of putting that that onus also in the chemist's hand? And of course, the companies will then push their brands through the local pharmacists. If the doctors are not doing it, the pharmacists might do it. Dr. Jayadevan, first you.
Yes, that's an excellent point you raised, because self-medication is quite common in our country and elsewhere. And there is nothing wrong with self-medication, especially if it is done within the limits of safety. For example, we've often said on radio and television and the paper that somebody with 1 day of fever, if they are previously healthy, there's no need to rush to the hospital, and so on. And that will keep the crowds in the hospital down as well. So back to your question, I will start by clearing another common myth. Many people seem to think that a generic medicine, because it costs cheaper, produces less profit to the seller. Guess what medication generates more profit to the seller, to the chemist shop? More likely, it is the low-cost product, which is made by a less-known company that is marked up so much that the seller makes a huge profit from it, compared to a reputed company whose product will sell itself. Now, I'm just generalizing here. There could be exceptions here, but it's a well-known fact that markups are a strong indicator or a strong force that decides what the patient ultimately gets. And this decision, as you pointed out, Shreya, it occurs at the sales counter, on the pharmacy counter. And the person selling it in India almost invariably is not a pharmacist. The pharmacist could be elsewhere. The store is typically manned by somebody who does not have a medical qualification, including a degree in pharmacy. So it is an interaction between a patient and a clerk, and the decision is taken commonly, I hear, based on profit margin, and the product that gets sold could well be the lowest quality product that's available, or something that's close to the expiry date. So there are many things that can slip between the cup and the lip. And if I were ill, and if I were to see somebody, if I were to see a doctor, you know what? I would not even look at what the doctor wrote. I would just hand it to the pharmacy and say, please get me what this doctor wrote. No questions asked. I know that there are cost concerns, and doctors are sensitive about this, depending on the area that they practice in, and depending on what is available. For example, relatively small numbers. For the most part, doctors are very conscientious, they're very protective, like a mother hen of their patients.
Absolutely, absolutely. We of course agree with that. But before wrapping this discussion up, quickly, my last question to Dr. Rohit Bansal: what is the way forward? Because for example, somebody who is suffering from a comorbidity, somebody who's taking high BP medicine or sugar medicines, wouldn't generic drugs sort of be effective in cost cutting and be lessen the financial burden? Or even without comorbidities, if somebody is undergoing a cancer treatment, for them to just a generic drug prescription in some cases can reduce the financial burden considerably.
Absolutely, I agree with you. The generic medicines, like you initially pointed out, cost 30 to 80% less than the branded drugs. But again, the quality issue comes into play. So if the quality can be assured, like we have in Western countries, nobody will have any objection in prescribing generic medications at all. So if we talk about the cancer drugs, Nobody would want to take a chance experimenting with a generic drug, which you're not even sure about. Fever, all right. But for a cancer drug, I'm not sure whether anybody would want to take a chance unless you know this particular drug that I'm taking is 100% potent. So yeah, definitely we need to lay down strict guidelines. We need to lay down strict quality control criteria and ensure the right kind of quality reaches the patient.
Yeah. All right. With that, of course, I'm going to wrap this discussion up. But the fact remains that quality check and patient safety is what should be the focus at all times. Thank you very much, Dr. Rohit Bansal and Dr. Jayadevan, for joining us and sharing your perspective on Mirror Now. Thank you, gentlemen.